And in other news, this week, the Trump administration announced sweeping changes to the U.S. childhood vaccine schedule, reducing the number of diseases vaccines are broadly recommended for from 17 to 11. ABC 10 News reporter Olivia Gonzalez-Britt spoke with a local doctor who serves on the American Academy of Pediatrics committee and says what's most alarming isn't just the changes, but how they were made.
My whole life has been taking care of sick children, and I'd rather prevent disease than to have to treat it.
For decades, pediatricians like Dr. John Bradley have helped shape national vaccine guidance through the American Academy of Pediatrics.
And we all feel proud of it because everyone contributes. Everyone has a chance to raise their hand and say, well, what about this? What about that? And so everything gets discussed.
That process, grounded in scientific evidence, is how the AAP develops its vaccine recommendations by analyzing risks, vaccine safety, effectiveness, and cost. Now, historically, those recommendations have aligned with guidance from the CDC's advisory committee until now. This week, the administration released a new federal vaccine schedule, recommendations that often influence what vaccine states require for schools and which shots are covered by insurance. Under their new guidance, healthy children are broadly recommended to receive 11 vaccines instead of 17. And Dr. Bradley says how the CDC came out with this recommendation matters.
If the CDC had said, let's have a meeting, let's discuss this, we think the disease recommendations need to be modified, I would have been really happy.
Instead, Dr. Bradley says they were left out entirely, prompting sharp pushback from the American Academy of Pediatrics, whose president called the changes dangerous and unnecessary.
I probably would have picked other words, but when you take care of children and the parents depend on the healthcare system to tell them which vaccines they should take, it's dangerous because if you don't give vaccines that we've been giving and have been shown to be safe and effective, and a child ends up in the hospital, that's preventable.
Now, parents and pediatricians are trying to understand what this means in practice, including whether some vaccines could become harder to access or harder to get covered by insurance. Some medical offices may take extra steps, and doctors worry confusion could undermine trust.
If we can't recommend it in association with the CDC any longer, that takes away some of the credibility the pediatricians may have.
So could more change be coming? Dr. Bradley hopes not.
And I hope that they learn that this pushback from all the professional societies and parent groups will have them think twice about just releasing a policy for vaccines without getting everyone's input.
For ABC 10 News, I'm Olivia Gonzalez-Britt.